Well, should South Africa once again consider getting the AstraZeneca vaccine? It's emerged this vaccine is more effective against the dominant Delta variant that's currently ravaging the country. Well, South Africa sold its stock of AstraZeneca earlier this year because it was less effective against the previous dominant variant. So what do we do now? Well, let's chat to Shabir Madhi, Professor of Vaccinology at Wits. Prof, a very good afternoon. Thanks so much for your time. So I suppose that is the question. AstraZeneca, as we know, was found to be ineffective with previous variants. Now it has been found to have an efficacy of at least 60% with this Delta variant if 2 doses are taken. What is the evidence actually saying about this? What do we know? What is the data saying about it?
That's a good afternoon. So it is correct that the AstraZeneca vaccine didn't protect against mild to moderate COVID-19 due to the Beta variant. But despite that, in January already, the World Health Organization had indicated that even in countries where the Beta variant was dominating, those countries should still continue using the AstraZeneca vaccine. South Africa's government and its advisors decided to go against the World Health Organization decision at that stage, and it has come back to haunt us. What does evidence currently show? It shows that AstraZeneca vaccine still very likely would be able to protect against severe disease due to the Beta variant. But in addition to that, what we now see is that AstraZeneca vaccine, in fact, is protection against hospitalization due to the Delta variant. In a recent analysis completed in the United Kingdom, shows vaccine effectiveness of 75% after the first dose and 92% after the second dose. For less severe disease, as you mentioned, around about 60% protection. But what we're wanting to do is it's all about saving lives rather than preventing these mild illnesses, which most vaccines would come short when it comes to the Beta variant and possibly the Delta variant as well.
So, Prof, what do we do now? Do we start trying to acquire AstraZeneca again, or do you think with Pfizer, like they say, in 2 doses having at least 88% efficacy, do we actually need AstraZeneca?
Well, we need to get as many people vaccinated over the shortest period of time. It's not about the quantity of vaccine that we've got. It's about the quantity that we have immediately and that we can actually get into the arms of individuals before the next resurgence arrives, which probably will be towards the end of the year after this one is dissipated. So it's all about ensuring that we have all options on the table of vaccines that the WHO has actually approved for use with good scientific evidence. And we need to make sure that we get those vaccines into the arms of individuals as quickly as possible, especially people over the age of 60 and other individuals that are at high risk of developing severe COVID-19, irrespective of whether it's a Pfizer vaccine, the AstraZeneca vaccine, or a Johnson & Johnson vaccine.
All right, Prof, before we get to the next question, if I can ask you to please switch your camera back on. We seem to have lost your picture, but we can still hear you. So if you can fiddle with that. There you are. We have you back. All right. What are your thoughts on the Johnson & Johnson vaccine then? Do you think that that might be effective? What do we know about it?
Yeah, so the Johnson & Johnson vaccine certainly would perform as well as the AstraZeneca vaccine performed in the United Kingdom. And when it comes to severe disease, I wouldn't expect the Johnson & Johnson vaccine to perform any less well than the AstraZeneca vaccine, even after a single dose against the Delta variant. The big challenge that we face for the Johnson & Johnson vaccine, I believe, is one of whether it will actually protect against mild COVID-19. And that is particularly important in the South African context, where we're rolling out these vaccines to healthcare workers and teachers. And yes, they will derive great protection against severe disease. But it would be dangerous if the teachers, as well as healthcare workers and others that receive a single dose of the Johnson & Johnson vaccine under the belief that they're actually protected against infection or mild illness due to either the Beta or the Delta variant for that matter. The Johnson & Johnson vaccine works really well against severe disease, but evidence as to how it would perform against mild infection, which the AstraZeneca vaccine showed, didn't actually protect against mild infection due to the Beta variant. I would suspect the same thing would be the case for the Johnson & Johnson vaccine. So I think we need to be cautious in creating an expectation that the single dose of the Johnson & Johnson vaccine is going to provide you complete protection against COVID-19. It's not. It will provide you high levels of protection against severe disease. But for those that are otherwise healthy in their 20s and 30s, the teachers that are getting vaccinated right now, they're not going to derive that great benefit from the Johnson & Johnson vaccine. And to some extent, also a single dose of the Pfizer vaccine would come short. The Pfizer vaccine requires 2 doses of that vaccine to be able to provide at least 75% protection against mild disease due to the beta variant, and probably would be the same when it comes to the Delta variant. So again, just a caution that a single dose of the Johnson & Johnson vaccine will provide really good protection against severe disease, and that is what South Africa needs to focus on in the immediate future. But those individuals aren't necessarily protected against infection and mild illness due to the Delta variant or the Beta variant.
We're also hearing that Johnson & Johnson could work with a booster being given afterwards. Your thoughts on that?
Yeah, absolutely. I think it's just a matter of time before we see a booster being included for the Johnson & Johnson vaccine. And in fact, a good combination would be the Johnson & Johnson vaccine followed by a Pfizer vaccine. There's a study which was done on the AstraZeneca and the Pfizer vaccine. And remember, the AstraZeneca and Johnson & Johnson vaccine are very similar in the technology that's used to develop those vaccines, and they elicit similar sort of immune responses. In the study of the AstraZeneca and the Pfizer vaccine, you actually got a better immune response when combining the AstraZeneca with the Pfizer vaccine than 2 doses of the Pfizer vaccine. And we need to become more innovative in the manner in which we're actually deploying these vaccines and think beyond just what's on the surface. So I think South Africa should actually seriously consider a single dose of the Johnson & Johnson vaccine followed by the Pfizer vaccine as being scheduled that we actually pursue with the vaccines that we've got at hand.
Okay, so the overall message there, Prof, if I'm reading you correctly, is just keep vaccinating, use what we have, and then should SAHPRA also then expedite its plans to bring in any new vaccines that might work against Delta, or should we be just okay with just continuing to get this out there with what we have?
SAHPRA needs to expedite every process, but needs to maintain scientific integrity in evaluation of whatever comes to its table. So it's not up to SAHPRA to manufacture the data. It's up to SAHPRA to review the data, the safety data, as well as efficacy data, and how the candidates would likely perform now against the Delta variant before it makes an informed decision as to whether this vaccine, any vaccine, is actually suitable for use in our context. So yes, SAHPRA needs to make sure, and I think they've got the processes in place to ensure an expedited review, but that cannot come at the cost of sacrificing the integrity of the results, in particularly the safety of the vaccines, as well as how well they're expected to perform. It's meaningless having lots of vaccines into the arms of individuals if it's not going to yield much benefit in protecting against severe disease.
Yes, and absolutely. And on that note, Professor, then I'd like to know what it is you'd like to hear from the President tonight.
Well, what I would like to hear is that somehow miraculously we would have got everyone vaccinated before this current resurgence, which unfortunately is not going to be the case. So where we're stuck right now is how to mitigate onward transmission of the virus. And unfortunately for a province such as Gauteng, whatever measures are implemented overnight is going to have a nominal effect as to what we're going to experience when it comes to hospitalization and death over the course of the next 2 to 3 weeks, because many of those people, unfortunately, are those that are already infected with the virus. And considering what the trajectory of the Delta variant in India, it's very likely we're about to peak already in Gauteng, and we'll be on a downward trajectory in the next week or two. So for Gauteng, it's a bit too late. Perhaps there's something can be done for other parts of the provinces. The most critical element and the most critical intervention that we can put into place is to have a complete ban on indoor gatherings, be it the pubs, be it the restaurants, be it places of worship, be it the shebeens. Even having 10 people in those sort of spaces lends itself to super spreader events. It's not about a number of people, it's about the space, the ventilation in the space, and the behavior of individuals in that space that determines the ability of the virus to transmit rapidly. So the single most important intervention for South Africa, in my mind, is a complete ban of mass gatherings, at least for the next few weeks for some provinces. And people need to be responsible about wearing a face mask, seeing that unfortunately they've been failed in terms of being timelessly vaccinated.
And your vaccine, Dr. Madhi, if you have taken the vaccine already, which one have you taken, and how have you been feeling since?
Yeah, I was fortunate enough to get the Pfizer vaccine. I received that about 4 or 5 weeks ago. No side effects from that, and looking forward to receiving my second dose of vaccine. But at the same time, unless there's adequate supply of the vaccine, we need to ensure that everyone gets, as many people or high-risk individuals get at least a single dose of the vaccine. Second dose of vaccine is important, particularly for protecting against milder form of illness. But single dose of even the Pfizer vaccine would probably confer good protection against the Delta variant, and that is what is shown in the United Kingdom when it comes to hospitalization. So right now, our focus shouldn't be about a second dose of vaccine. We need to get as many people as possible who are at high risk of developing COVID-19 immediately vaccinated with a single dose of either Pfizer or the Johnson & Johnson vaccine before we open the doors to people receiving a second dose of the vaccine. We need to be wise about the limited supply of vaccines that we've got available to us in terms of how we use it, and the way to use it right now is to maximize penetration of at least a single dose of the vaccine. A single dose of the Pfizer vaccine had roughly about 90% protection against severe COVID-19 due to the Delta variant in the United Kingdom, and that is what we need to focus on.
And if I can ask you very quickly, Professor Madhi, should we be changing maybe the nature of our phases? I mean, where we're going via ages, we're going via the healthcare workers, you know, and I had a very interesting conversation about what about those who are in the front line in other ways, like supermarket, you know, tellers, those who come into contact with people all the time. They may not fall into those age groups, but they certainly are more susceptible than the rest of us.
Yeah, as it happens in South Africa, in fact, people that are in the service industry, including tellers, were at higher risk of developing COVID-19 until January of this year compared to teachers. Yet teachers are being prioritized, and the reason for that is probably more political rather than driven by science, because tellers probably are at higher risk in the South African context of having been infected with the virus by the time the second wave would arrive. Who should we be targeting? We shouldn't have a completely open door policy because we don't have the resources, we don't have the structures in place to be able to deal with hundreds, thousands of people pitching up on a single day. But we should have a completely open door policy. Certainly everyone above the age of 60, irrespective of whether they're registered on EVDS or not, which I think to some extent now has been implemented. In addition to that, anyone above the age of 40 with an underlying medical condition, people with obesity, diabetes, hypertension, cancer, those individuals need to be allowed to be vaccinated as quickly as possible, which means tomorrow again.
Yeah.